Good morning, it's Michael Mallinson again, reporting from the Canadian Rheumatology Association annual meeting for the Arthritis Broadcast Network. And this morning my third guest is Laura Paslan. So I'm just going to let Laura introduce herself, and Laura, perhaps you can tell us who you are and what your role in rheumatology is.
Well, thank you, Michael, for inviting me to speak with you this morning. My name is Laura Paslan. I'm a physiotherapist practitioner at the Toronto Western Hospital. I'm also a clinician investigator with the Krembil Institute and a lecturer at the Department of Physiotherapy at the University of Toronto. So primarily my role at the Toronto Western Hospital is working in spondylitis. I work with Dr. Haroon and Dr. Inman. And my roles there are various. So I have a strong clinical role, but I also do quite a bit of research as well.
Can you explain the clinical role? Do you actually get to meet patients and teach them exercises, or is it more of an advisory role? You just tell them what they should be doing?
So I have many different clinical hats that I wear, in fact, and so I'm an advanced practice physio, so I've done the ACPAC program, so I do work closely with Dr. Haroon and Dr. Inman in their clinics, so I help them with their follow-up patients and help with the volumes, getting the volumes through the clinic. In addition, I also provide exercise consultation for those patients that require. And another part of my role is I run a spondylitis screening clinic with my colleague Chris Hawk, who is also an ACPAC graduate physiotherapist. So the idea there is that we have patients who are referred to us from primary care, so mainly family physicians, but sometimes through physiotherapists and chiropractors working in the community. For patients that they're seeing who have back pain, and they have a suspicion that maybe there's something more going on here than mechanical back pain, they'll refer their patients to our spondylitis screening clinic. Chris and I will go through a history, physical exam, and then we'll order the appropriate investigations, including x-rays and the appropriate blood work. And based on our assessment and our experience and our training, we basically decide, okay, does this person have a high risk for axial spondyloarthritis? And if so, because we work closely with our rheumatologists, we would pull them in and have them confirm diagnosis, or maybe they need to order further investigations such as MRI. If we feel that it's not likely spondylitis, it's more mechanical back pain, because of our knowledge as physiotherapists, we can provide them with some sort of baseline information to kind of point them in the right direction in terms of self-management, and then refer them back into the community.
Oh, I see.
So it's been a good program. We've done lots of evaluation on it. We've been able to sort of improve access. The main aim is to provide early detection. So we want to identify patients earlier so that we can get them on the appropriate management, keep them active in the community, working, productive, so that their issues and their back pain don't really impact on their day-to-day activities.
And how important is exercise in the treatment of AS?
It's very important. Just as important, it's the cornerstone of management for spondylitis, just as important as the pharmacological management. And I think that by me being present in the clinic, I'm always reminding the rheumatologist that this is part of the process, the management process for patients. And I think that's what's so good about the interprofessional approach with our particular program, is because the rheumatologist and Chris and I work so well together, and we really provide a comprehensive approach to patients, because exercise is absolutely key. It's proven, there's so much evidence to support it in this patient population, and it's really important to drive that message to patients as well as other practitioners, because it is just as important as the medications these patients are on.
I like to say there's two forms of exercise. One is therapeutic, to maintain flexibility, range of motion, and the other is recreational, which is for all those other things. It's good for the soul to exercise in that sense, so it can reduce your pain and fatigue as a patient. So would you agree there's two types of exercise there? Or
Yeah, I mean, it depends on the patient. I mean, really the goal is to get people up and moving, because any form of physical activity is going to help. It's going to impact on their overall health, not just with respect to disease symptoms and improving symptoms such as pain, stiffness, fatigue, those sorts of things, but also overall health. We know that there can be a cardiovascular complication with spondylitis, so making sure that we're addressing cardiovascular fitness. So any form of physical activity, just getting you up and moving, improving what you're already doing is going to be key.
Yes. I'm just going to show our audience the Ankylosing Spondylitis Guidebook produced by the Canadian Spondylitis Association. We have some exercises in here. I don't know if you'd like to take a quick look at those, and they are well tested, but these are the sort of exercises that AS patients should be doing.
Absolutely. So the main goal is you want to focus on posture, because posture is the foundation for function as well as appropriate exercises. Flexibility, core strengthening, and you want to, like I said, add a cardiovascular component into that.
And at the UHN, you have some other resources for ankylosing spondylitis on the website.
Yes, indeed. So we've recently developed a very comprehensive e-learning module for people with ankylosing spondylitis. So this was developed by an interdisciplinary team. We had a strong patient involvement as well. We had patients, we had pharmacists, occupational therapists, nutritionists, we had spiritual care involved that came together, and we did a needs assessment with the patients at the Toronto Western Hospital to really identify what information would be important to include in an e-learning module. So based on their feedback, we took this interdisciplinary team and basically built the content for this, and then through the help of the University Health Network Patient and Family Education Department, we were able to pull it all together as well through the UHN e-learning module department as well. So you can go to www.wegotyourbacktwh.ca, and you can access that. It's open access, it's free to everybody, and we hope that it achieves patient education.
Yes, that's important. I know your time is tight, so we're just going to see if there's any questions from the audience. Have any questions come in, ladies?
I don't have any at the moment. Can you demonstrate for us a type of exercise that is good for someone living with AS?
Demonstrate an exercise in my dress here.
Your dress. Maybe just this one.
You know what? I think I'm going to actually just talk about posture, because posture is really important. And posture, I think, for all of us, we all tend to be in our flexed, sort of on our computers, on our phones. We're driving all the time, watching TV, and we all sort of get into this habitual kyphotic posture. So really,
explain that. Kyphotic.
So kyphotic meaning sort of that rounded head forward posture that really predisposes you to a lot of issues. Even if you don't have inflammatory back pain, it can predispose you to mechanical issues as well. So always thinking about keeping your ears over your shoulders, and your shoulders, if I stand up, is the camera going to be able to see me?
Yeah.
Okay. So ears over your shoulders, shoulders over your hips, hips over your knees, knees over your ankles. If you can kind of remember that, you're going to optimize your posture. And that's what's really important. And when you're sitting, another pearl I'll give you, is if you can get like a rolled towel, or they sell lumbar rolls, you can get them at Shoppers Drug Mart or wherever.
Mm-hmm.
They just sit in the lumbar area, so you sit with your buttocks right to the back of the chair, and it helps to maintain the natural curve in your lumbar spine and promote appropriate posture when you're sitting. And the other key with sitting is that you don't want to sit for more than 20 minutes at a time. So just simply standing up, take a deep breath, sit down. At least you're breaking up that habitual postural cycle that puts a lot of strain on your joints, ligaments, and muscles.
That's really important for someone who wants to stay at work while living with AS or any spondyloarthritis.
Yeah.
Excellent. Those are great tips.
Great.
Now we have a further tip in here about using a standing desk at work.
Yes, standing desks are good. Yes, for sure.
Thank you, Laura. Thanks
Thank
for
you,
your time.
Michael.
Thanks for coming in.